Parkinson's education, and particularly deep brain stimulation, which is my main area of focus and a passion of mine. So thank you so much. It's great to have you in the community, and thanks for having me.
Thanks so much.
Great. So an initiative that I'm very much a proponent of is not just treatment of Parkinson's from a medication perspective or deep brain stimulation perspective, but really this holistic perspective. I feel like even if you have the most optimal therapy, whether it's medication, deep brain stimulation, a good team around you, nothing really is going to work unless the building blocks of non-pharmacological care are basically looked at. And these are things like sleep and exercise and, socializing and reducing stress and, hydration. But one of the biggest things I get asked, and I run 2 support groups for patients with Parkinson's as well as caregivers, is about nutrition. What should I be eating? What are things that are good? What should I avoid? And so, I'm really happy to be part of this initiative, really focusing in on nutrition in Parkinson's. And, again, we've heard a lot about neuromodulation. So we can kind of touch in on that. So we can go on to the next slide. As you know, there's about 7 to 10 million patients worldwide that have Parkinson's, about 1 million to 1.5 million in the US. But interestingly enough, that number is only going to double by the year 2030. There's supposed to be double that number of cases and even triple by the year 2050. I think we all know someone who has Parkinson's in our lives, whether it's a loved one, someone in the community and things like that. But think about that number really increasing significantly. It really is growing. And a couple of reasons for that. Patients are living longer. There's more therapies available for patients, including what we heard about deep brain stimulation, which I think is really terrific. And also, I think patients are being diagnosed earlier, as well as probably more environmental factors that are coming into play. So this number is here and it is what it is, but it's going to increase. Hence why it is so important to stay educated and stay on top of Parkinson's, so that we can really combat it as the prevalence increases. Next slide. So as we know, the symptoms of Parkinson's are essentially a loss of dopamine. By the time someone is diagnosed with Parkinson's, they already have about 50 to 70 to 80% of dopaminergic neurons that have been depleted. So there's a whole kind of slew of premotor symptoms. And that's the key thing, is really how can we restore and replace dopamine? And again, it's not just with medications. I mean, it really is all about lifestyle and things like that. This is related to an area in the brain called the substantia nigra, which is really deep in the midbrain, and that tends to degenerate, hence why there's a loss of dopamine. But there's other transmitters involved, including something called acetylcholine, which accounts for cognition and how we think and, our level of alertness and things like that. So again, it's beyond dopamine. There's other neurotransmitters that are very much involved. We can go on. And, the hallmark symptoms are things like loss of movement, akinesia, bradykinesia, slowness of movement, also tremor and rigidity. Not every single patient needs to have all of those hallmark symptoms. In fact, there's a lot of misconception that if you don't have a tremor, you can't have Parkinson's. No, we know that's not true. But typically, when you make a diagnosis, a patient has to have slowness of movement, the akinesia, the bradykinesia, as well as an increase in rigidity or bradykinesia, or rigidity or tremor. And again, the symptoms of Parkinson's really vary over time. No 2 people are alike. There's no 2 people in my practice that are alike. No 2 people, I think, in the community that are alike with Parkinson's. Every single patient is different, whether in regards to what symptoms they develop, what symptoms they may manifest down the road, and also sort of where they are upon diagnosis. Many of the premotor symptoms, so this even predates the diagnosis of Parkinson's, can occur. And these are things like loss of smell, constipation. Oftentimes, depression and anxiety can occur prior to even the development of Parkinson's. Patients just feel unwell mentally. Sleep issues, things like talking in the sleep, yelling in the sleep, what we call REM behavioral disorder. That's a very common one that can often pre-manifest the diagnosis of Parkinson's. So once a patient is diagnosed, essentially you make the diagnosis based on these symptoms. There's no MRI that you can get, no blood tests and things like that. It's really, really clinical. And then you follow the patient through the course of their the condition. So you really are following a patient sometimes pre-diagnosis, at diagnosis, and then throughout. And this is why I really want you to realize that Parkinson's is a spectrum. It doesn't just start, when you're diagnosed. There's been a slew of, ongoing symptoms prior to that. But then once you're diagnosed, there's a lot, sort of in the pipeline in terms of what symptoms may develop. Hence why optimizing therapy, whether it's medical or surgical from the very beginning, is really, really super important. And this is why I like all my patients to see a movement specialist or see someone who's really invested in movement disorders from a neurological standpoint, just because each decision you make based on each symptom is so important. And this is not just a condition you see patients once for, and then that's it. You really see them and then you follow them throughout. And so knowing my patients, knowing their underlying psychosocial status, the caregiver status, just everything about them, how the symptoms are impacting them and things like that really do help to treat effectively. Next slide. So again, it's not just about going to the medication management, upon diagnosis. It's not just about, talking about advanced therapy. It's what's on the left-hand slide. Lifestyle, quality of life, non-pharmacologic measures. Everyone really should be detailed on diet, choices about food and things like that. And then again, exercise. Remember, the only thing that will slow the progression of Parkinson's is exercise. And it really is a mix of, some light cardio, gait and balance training, strengthening, stretching. All exercise is good. It helps to promote mobility, flexibility, but it also helps with these non-motor symptoms, including the mood, apathy, depression, anxiety. It helps a lot with, underlying symptoms, muscle cramping and things like that. So the diet and the exercise combined are so important in combination with medication management and consideration of deep brain stimulation. Next slide. So the role of nutrition. So, this is really important. And, Parkinson's disease and nutrition really meet together. I mean, there is this big role of nutrition in Parkinson's. We know that Parkinson's can affect things like constipation. It can cause thinning of the bones. It can cause swallowing difficulties. And so it is important to take those things into account and then kind of choose a diet based on that. We also see that, nutritional deficiencies essentially can really influence complications of Parkinson's disease. There can be medication interactions, weight loss, and dehydration. The worst two combinations are a patient with Parkinson's that becomes dehydrated. It often leads to falls and cognitive slowing and dizziness and lightheaded. It's a big reason for hospitalizations and ER visits. So we really encourage our patients to stay hydrated. Unplanned weight loss is something you really need to bring up with your provider, because once someone really does lose enough weight, they start to burn through muscle mass, and we need all the muscle mass we can get to strengthen and to really promote movement. So these are all really important, and this is why nutrition is such a big building block for the treatment of Parkinson's disease. So a balanced approach matters. Protein actually is good. There's a lot of misconception about protein interacting with levodopa, and it does, but in times of spacing and timing and stuff like that, the brain still needs protein, muscles still need protein, and then really promoting vitamins and minerals just to support this kind of cellular function, rebuilding, repair of tissue, hence leading to total body wellness. Next slide. So, constipation is a huge issue in Parkinson's. It can start prior to the diagnosis of Parkinson's. 80 to 90% of patients can develop it, and it's one of the most common non-motor symptoms of Parkinson's. We know that there's a significant amount of gastroparesis. That means the movement of the muscles that are used to push food through the digestive system are slowed. Things just have a slow transit, hence why things build up and lead to constipation. The other issue with the gastroparesis is that when someone takes their oral medication, it doesn't kick in. They may wait 30 minutes, 60 minutes, 90 minutes because the pill just sits there. It's not being absorbed. And so these are really big issues. Parkinson's is as much of a GI issue as it is a brain issue. So it is important to really look at your gut, take into account, are you having kind of slow motility? Are you having bloating? Are you having constipation? And then work on it. Fiber is one of the best ways to help. It helps with absorbing fluids. It helps with passing, maintaining GI motility, passing soft stool. And again, fiber doesn't work on its own. You have to drink enough water. Hydration is so super important for patients with Parkinson's. And one of the big reasons is because of the constipation that might occur. Next slide. So bone health, both men and women are at risk for bone thinning, especially, with things like osteoporosis. And when someone is at risk for bone thinning, they are a much higher risk for falls, which lead to disabilities, fractures, and things like that. We know the worst thing for a Parkinson's patient who may be doing well is to have a fall, which can lead to more comorbidities and setbacks. So that's a big issue. And, these are increased by malnutrition or weight loss. So patients with Parkinson's really should be balanced and eating the meals that have calcium and magnesium and vitamin D3, potentially K. And again, they're higher fall risk, the likelihood of falls increases as Parkinson's advances. Yes, supplements may work, but the best way to get these nutrients is through diet, whether it's supplemental shakes or it's actually in the diet. Next slide. So food and medication interaction also is important. I have a lot of patients who come to me. Sometimes they were just diagnosed with Parkinson's. Other times they may have had it for many, many years, and they just stopped eating protein because they read, they shouldn't be eating protein. I tell all my patients the brain needs protein, almost like building blocks to, help with basically neurological function, but also for muscle mass. So it's not that you have to limit protein, but sometimes timing the meals can be very helpful. It's usually about 30 to 40 minutes of a meal time to the medication. And that can help. And again, this is why I have all patients oftentimes keep a food diary and things like that, so we can really get a feel for what they're eating and how that affects the medication. But if patients are not eating protein or they've cut it all together, that can lead to unhealthy weight loss with a weakened immune system. Next slide. Some patients do develop swallowing difficulties. It's rare for a Parkinson's patient to completely not be able to swallow, but we do see patients oftentimes have silent aspiration, things get stuck in the throat, they're not clearing the secretions, and that can lead to things like aspiration pneumonia. Oftentimes, if a patient perceives swallowing difficulties, they stop eating things or they stop drinking water, which again can lead to malnutrition. One thing that I'm a big proponent of is a multidisciplinary team. I don't treat my patients with Parkinson's alone. I have a whole team of patients, of caregivers and providers. And a big one is our speech and swallowing therapists. And they really do help to give exercises and strengthen vocal cords and just help with things like swallowing and just overall abilities. So again, if swallowing is an issue, it should be brought up. I'm a believer that if you can catch it early, you can work on it, much more effectively, than when someone comes in and they're having recurrent admissions for aspiration pneumonia and so on. So very important to take into account. Next slide. And then again, the worst combination is a patient with Parkinson's to develop dehydration and hypotension. Dehydration can lead to UTIs, confusion, dizziness, fatigue, cognitive slowing, pain even, and things like that. And it can also lead to what we call postural hypotension. When a patient goes from lying to sitting or sitting to standing, the blood pressure drops. Patients can get significantly dizzy, often fall. And it really just portends a poor quality of life. So the dehydration aspect is often overlooked. I think we're all guilty of not hydrating enough, but in Parkinson's, it's absolutely crucial. The hydration component is so super important. And I often have patients keep a little bit of a water log or a diary almost to document how much they're drinking in terms of water. I'm also a believer, before you get out of bed, you wake up in the morning, you keep a jug of water by your bedside, usually about 8 to 10 ounces in the morning, and start your day with, just hydration before you do anything. I think that makes a big difference. The amount of water really depends on, there's no, everyone is very different. This is why I think to speak to your specialist about it. Usually we take into account things like renal function, other medications someone might be on, body weight, body mass index, and things like that. But, enough hydration is really important. I think as a minimum, at least 3 to 4 kind of 12-ounce bottles of that Poland Spring or any of those water bottles a day are very important, but many of my patients use a lot more. Next slide. So nutrition helps, again, and unplanned weight loss. I see that quite often, whether it's because of, medications or comorbidities or things like that. Patients need to keep up their weight. If they don't, they will start to lose muscle mass. So things like using high calorie, high protein foods that are still healthy, eggs, nuts, and cheeses. You can add in some calorie rich or nutrient dense snacks throughout the day. And then, I'm a big proponent of nutrition supplements, especially if someone is having poor appetite. Patients with Parkinson's have trouble eating one big meal at a time. They tend to like smaller, more frequent meals. Taste is also affected because of lack of smell. So, if someone really isn't getting their apt nutrients by diet, I'm a huge proponent of using supplements. Fatigue is a big one too, essentially things, if a patient has to prepare their own meals, if they're really fatigued by kind of putting things together or hard to chew things, it is important to take that into account. And again, I like that small, more frequent meals. I think that is so much better. Again, we talked about constipation, so we want to bulk the fiber. And there's many ways of doing that, but fiber is not going to work unless patients are staying hydrated. And again, activity, exercise is going to play a huge role with helping with, just slow motility. And then dehydration and Parkinson's are the worst combination. Very important to stay hydrated. Not even stay hydrated, but be cognizant of how much you're drinking in terms of water, and, added fruits and vegetables that might have, a good water amount of intake, and then, replenish any electrolytes. Great.
Awesome, doctor. Thank you so much. I'm going to stop sharing screen so that way everyone can see you. I guess one of the big questions that I got from emails, and you touched on it briefly. So, protein, as you said, is very good for everyone. But the protein problem that they like to say, which I think is why you had to mention that protein's still good. When should they be avoiding protein? The combination of the carb relief of their protein, I guess really just indulge a little bit more on that if you can.
Yeah, so again, this is a big thing in terms of patients who restricted protein altogether because they felt, it wasn't good for them, or they sort of read that it's going to block the dopamine and things like that. Yes, when you take protein and you take levodopa, essentially, which is cinnamon, too close together, they sort of fight to compete to get into the brain. And because protein is a little bit bigger and heftier, it usually wins. So the protein gets in the brain, but the cinnamon or levodopa doesn't. It washes out. So patients really have a delayed on, or they might have a dose failure where it just doesn't work at all. And that's a problem. But the best way to avoid that is to time it out. So it's usually about, they can take their medication maybe about 30 minutes prior to a meal, or sometimes 40 minutes after, depending on the timing. And it really is like more than a fistful of protein. You really do have to kind of watch for the interaction. Anything less is okay. But again, I can't tell you how many patients I see that have just stopped altogether. So it's really, really important. And then, with the ketogenic diet, which is essentially very protein based, that fuels the brain. It's wonderful. Not that we want our patients to, strive to get into ketosis or things like that, but it really is a very good brain healthy diet if you can do it sort of responsibly without, sacrificing the medication effect.
Okay, very good. Yeah, that was also one of the questions, was the efficacy of the ketogenic diet. One thing that I did hear you say, and I know it's not a talk about speech, but I think it was super important that you touched on it. So the difficulty with swallowing, I guess maybe in relationship to food, oftentimes I'll hear, you hear it went down the wrong pipe. And they're not attributing that necessarily to their Parkinson's disease. So maybe a little more about something, examples of when someone's swallowing that they should be concerned that it is of a Parkinson's difficulty.
Yeah, it's a great question. And again, I like to be proactive and pick these things up early on. In Parkinson's, we think about movement being slow, whether it's, finger taps, or whether it's, kind of just gait and things like that, but we're not so aware of the vocal cords and how those can be affected. And typically in Parkinson's, in normal sort of everyday life, we clear our secretions so many times a day. We're not even aware that we're just, innately clearing our secretions. In Parkinson's, that becomes slowed. And hence, sometimes there's saliva that builds up. The swallowing mechanisms can be affected. And also with posture, oftentimes patients have different postures. Forward flex postures is really the wrong way to go. That can also promote some swallowing difficulties. So yes, if it's going down the wrong pipe and, if patients are noticing it more, not even just that, a lot of patients will describe coughing after eating, they'll describe nose running after eating or drooling after eating. This needs to be brought up because, again, if you can work with a good speech and swallowing therapist to boost those vocal cords, work on posture. Everyone should have their shoulders back, chin up, especially with eating. We're also guilty of this, especially being on the computer all day, but it makes such a big difference. So again, to be proactive with a symptom like that is imperative.
Awesome, thank you. There have been a couple questions about other foods is the possibility that other foods interacting with your medication, whether positive or negative?
Yeah, I mean, the one that's really been touted is more, large scales of protein. Obviously, we tell patients to stay away from processed foods, fried foods. Too much carbs can make a patient feel kind of lethargic in many regards. And one of the biggest initiatives in Parkinson's is if you are pre-diabetic or you're prone to diabetes or you have diabetes, you have to keep that insulin in check because unregulated insulin is just catastrophic in the spectrum of Parkinson's. So anything like with super high sugar or things like that. One of the biggest things I think if you can seek out is, find a good dietitian that you can speak to that will often have you keep logs. What are you eating for breakfast, lunch, dinner, snacks? When can I add supplements? When can I sort of go on to, how much water should I be drinking and things like that? That really does help to be able to shape the day. It's very hard for a Parkinson's patient to go it alone. We give them a lot of tips on how much you have to exercise and how much water to drink and how much we want you to socialize and, things like that. But the diet is tough, especially if you don't have all the resources. So again, making like a dietitian or someone you can speak to, a good primary care as part of that team plays a big difference.
Awesome. So a question about water. We're a big proponent of water, and I know there's quite a few people in this group who wives smacked them in the back of the head after you said that because it can be a problem sometimes for people to drink water. How much water should they be drinking?
Again, it's really individualized. We can't give a patient X amount. I mean, there are some thoughts that you should be drinking, a quarter to half your body weight, in water per ounces. I'm not sure that stands for everyone. And then patients, obviously, there's issues with urinary frequency and things like that. So the timing is important. I tell all my patients, if we do think that they are dehydrated, to keep a water log. That does help us kind of determine, start the day with a good amount of water. And in my exam room, I always keep just a bottle that we all know of, a 12-ounce bottle. You can get 3 to 4 of those in a day, particularly in the morning to mid-afternoon, so you're not having issues with going to the bathroom so much at night. It does make a difference. I've never had anyone up their water intake and tell me they felt worse. It's usually the opposite, always the opposite.
Okay, and then just one more thing on the hydration. What would be something for someone to look out for of being hydrated, right? How would they know they're possibly dehydrated or on the path to being dehydrated?
Yeah, so again, dehydration in Parkinson's can present in many different ways. It won't just be that I feel thirsty. It's really, really tricky. Patients can get recurrent infections, like urinary infections. The urine can be very dark. They might feel cognitively slower. I can't tell you how many patients felt like, they just feel like in a slump, they can't think or they feel super slow. And it really was because of dehydration, which may be a potentiating hypotension. Or low blood pressure. They might have more falls. They might have more freezing of gait. So that plays a big role. And the way to kind of define that is when you start to up your water. I have patients who come in all the time saying, I feel more alert. I can now exercise. I feel, much more energetic. So, what was attributed to just being, Parkinson's is actually more related to dehydration.
Okay, very good. One woman would like to know, can she have a glass of wine? She wants the doctor's advice.
Well, I think it depends on what other medications she may be on and and other comorbidities. So it's hard to advise based on the spectrum, but most of my patients, it is okay. Absolutely. Again, provided, you know, if it's just Parkinson's or Parkinson's medication, typically not white wine, red wine is what is preferred. And really just in moderation.
So I guess consult with your doctor, and if they say it's okay, have that glass of red wine, but make sure you're
If you're
pairing
on
it.
things like blood thinners or, you know, certain medications that are used for other conditions, that obviously that would be a consideration. But in just Parkinson's alone, it should be fine. As is coffee. I'm a big believer, especially with Parkinson's patients who are prone to a little bit of apathy, fatigue. You know, caffeine or coffee has been shown to actually be sometimes protective. So that's fine as well too. I have a lot of patients who stop drinking coffee because they're worried, but it's okay.
Oh, very good. Another question with protein, and specifically they're touching on wheat and pasta as a source of protein. Is that also included that you're talking about, or are you just more towards the your meats and fish?
So it's a little bit more of, I'm thinking more the pure protein, the eggs, the meats, the fish, the steaks, you know, anything that's really, again, more than a fistful of something. You know, wheat and pasta, depending on the amount, again, I would defer that to my dietitian, should not be so much of an issue. And again, I think if you do it in my way, which is smaller, more frequent meals rather than one big thing, you should be fine with that. I would be surprised that you'd have to stop that.
Okay. All right. Very good. Well, we're at 102. Is there anything else that you think you might want to add, or if anyone has a burning desire to quickly type it in?
Yeah, I mean, I just promote to all my patients that, again, you know, what Richard talked about, the deep brain stimulation and the medication, we've come so far, but unless these, you know, basic building blocks are met, you know, it's really hard for any of those therapies to do well. So I call it the seeds to living well with Parkinson's. You know, S, we could do a whole nother talk one day on sleep. S is for sleeping well, E is for eating well. Next, E is for exercise, D is for drink that water. And the last S is just for stress reduction and socialization. Again, my mantra is living well with Parkinson's. I have thousands of patients, you know, particularly with deep brain stimulation, who just do very, very well, but it really is about the building blocks.
Awesome. I guess one more quick thing, because I just thought of it now, but you talked about you know, getting a nutritionist. I think the big question would be, what should they be looking for in a nutritionist when they're seeking that out?
Yeah, you know, most of the nutritionists that we do work with, even if they're not super familiar with Parkinson's, are really quick learners. They really understand sort of the brain, amino acids, carbohydrates. I mean, all those things that are really important for integral brain function. But again, what you need to seek out in order to do well with Parkinson's is a team around you. That nutritionist or dietitian should be reaching out to the neurologist, maybe even the primary care. They should be aware of blood work and lab work. And so again, that cohesive multidisciplinary team is really important because we all learn from each other. But I think it is very helpful.
Awesome. Great. Well, thank you so much. I'm sure everyone got a ton out of this talk, and I really appreciate you talking about exercise, because that's the focal point of what I do, and both you and Dr. Ruji talked about it. So for those of you that have not started exercising yet, the time is now. So, and I think it's much, you know, there is a lot more being offered virtually. Of course, being in person and working with a physical therapist one-on-one is, you know, can be considered more efficient, but we can get moving, and anyone can be moving at this point now with all the great things going on online. So thank you very much.
Thank you, Chad, for setting this event up. It was great.
Great.
Yes, thank you for having me. What a wonderful turnout. Really appreciate it. Maybe we can do another session soon, but this was terrific.
Absolutely. All right, everyone, take care.